right. Thank you everyone for joining us. I'm Stacy Schroeder, President and founder of EVelop LLC, a training and consulting firm, and also the Cleveland Director for the Institute for Management Studies. Today I have the great pleasure of introducing Graeme Codrington. Graeme will be presenting 2 webinars for women in manufacturing this summer, Adaptability and Leading Change on August 5th, and Global Perspective on September 16th. He has graciously volunteered to share some of his insights and guidance today around COVID-19. Graeme is an internationally recognized futurist specializing in the future of work. He helps organizations understand the forces that will shape our lives in the next 10 years and how we can respond in order to confidently stay ahead of change. For the past 2 decades, he has worked with some of the world's most recognized brands, traveling to over 80 countries in total and speaking to around 100,000 people every year. He's the author of 5 best-selling books and on faculty at 5 top global business schools. Graeme is also an honored IMS faculty member. As you'll see, his delivery style is conversational, gently laced with humor, and liberally sprinkled with multimedia and inspiring stories to make the message stick. He works hard with clients to find ways to ensure value is taken back to the office and that his message makes a real impact on business outcomes. Graeme, thank you so much for joining me today.
No, pleasure, Stacey. And just listening to that intro now, I'm not sure how much humor there is in the COVID-19 presentation, but you know, we'll give it a go.
Great.
Thank you very much for the intro, and it's really great to just have this opportunity. My business card says that I'm a futurist, or when I'm working in Europe, they, I think, prefer the title futurologist.
Oh, wow.
And yeah, often people ask, you know, what is that? Can you predict the future? I wish I could. That's not the job of a futurist. No one can predict the future, of course. What we do, and I'm in a group called Tomorrow Today, that's our organization's name. And for the last 2 decades, what we've done is we've looked at trends. So we've looked at disruptive forces and at trends. We've tried to separate out the fads from the real disruptive forces and then help our clients to prepare for how the world might change. And the interesting thing is that this COVID-19 crisis actually gives everybody a little insight into our world, because with the fact that the COVID-19 virus has this 7 to 14 day incubation period in your body, it does actually mean we actually can see the future a little bit. We can look at countries that are a little bit ahead of us on the curve, and we're able to see where the virus is going. So with at least 7 to 14 days head start, and in many cases that's quite significant. The downside, of course, is that anything you do today, if a governor of a state makes an announcement today, you only see the effects in 7 to 14 days. And so it's very difficult to make policy, to make decisions, to implement any actions, because you really can't see the benefits of it for at least 2 weeks. So, right. You know, at the moment, I'm saying to people, this is my life. You are now living my life every day, because for the last 2 decades, I've attempted to do just that. I don't look 50 years into the future, not even 20 years. I just try and look a little bit beyond the horizon that most organizations normally look at. And depending on your organization, that might be 1 season, it might be 1 year, it might be 3 to 5 years, whatever your planning cycle is. My task is to kind of look just a little bit beyond that and to say what happens after what comes next. And obviously for the last few months, our team has been quite focused on this issue of COVID-19. It's one of the, obviously the biggest disruptors in the world. And I do have to say, we did predict this. Now, predict's a strong word in this. 15 years ago, we wrote a book on future trends, and we wrote a book on the 2020s. And we said 3 of the scenarios, which would be game-changing scenarios, would be a global pandemic, an asteroid strike, or a solar flare that causes a massive EMP, which is an electromagnetic pulse, which has the potential to wipe all computers clean.
Wow.
So, yeah, we said in the 2020s that was the worst case scenario we could imagine. We didn't realize it would be the first few weeks of the 2020s. And as I say, I mean, we didn't, let me not claim to have predicted anything. We simply said, this is a scenario. This would be one of the worst case scenarios. And now we're living through it, and it's frightening. You can't really plan for something this big. It's too big. I mean, what plans would you put in place? You can have a fire safety plan. You could have a disaster recovery plan. But this is too big. So we're all engaged in the moment. We're all trying to work things out as we go along. And what we've done for the last few weeks is we've just tried to be a few days and a few weeks ahead of the curve. So I hope this will be helpful for people in terms of what we as a team have seen in terms of what happens in the process of the virus coming through your country and how your country responds. So I don't have too many slides. This is not a major presentation. I don't have any multimedia. But I'll just throw one or two things up on the screen in case it's useful for people. The really best practice at the moment, if that is the right word in this environment, is to lock down. I think in America, you refer to it as a stay home order or stay in or shelter in place order.
Right.
Some countries around the world have gone much further than that. El Salvador went into a full quarantine for all 6 million inhabitants. Literally nobody's allowed to move anywhere. My home country, South Africa, where I'm talking to you from at the moment, we've gone into quite a significant lockdown. We are not allowed out of our houses except to go for groceries and for medical supplies. But we're not allowed to take we're not allowed to leave our own properties for any other reason. There are roadblocks on the road. You know, the army, the police force are out to check that everybody's doing it. And there are only a very, very few industries that have been called essential services. I know in most of the states in the United States at the moment, there is some similar format of lockdown, although, you know, there's a lot of variability across the 50 states. But best practice around the world is the more you lock down, the faster you deal with the crisis. And it's really fascinating to watch from the outside, Stacey, to watch America. And, you know, when I was growing up, I thought America was one country. When I started working and started coming to America and doing work across the places, I realized you're at least 50 different countries. And,
Very true.
and I think that's pretty evident at the moment. You know, different states are making different decisions. The problem is that if you don't all lock down together, if people are still allowed to move across state borders and to move from one city to the other, you really are not containing the disease. So it's going to be fascinating to watch what happens. And right now, let's put a timestamp on this conversation. We're on the 9th of April. It's not looking good at the moment. It looks as if some parts of America are really hit hard. Because, and let me just, sorry, let's see if the screen comes right. There we go. So there are 5 things that need to happen in order for lockdown to really work. It's not just about people sheltering in place. You have to do testing, because not only do you need to know who has the disease, you also need to know who has had it. Because with COVID-19, about 30% of people don't even show symptoms. They'll get the disease, they'll have the disease, and they won't even know they've had it. And that's really important to note. If you have the antibodies, that means you can probably be certified to go back to work, to get back into the economy. So the testing is not just to know who's got the disease, but also who has it and has antibodies. About 30% of people have mild symptoms, and mild symptoms means it feels like you've got sort of 2 or 3 days of a reasonably serious cold. You've got a headache, you've got a bit of a body ache, loss of appetite. The other third of people is where the problem is. About half of them get severe symptoms, and that means you really feel like you've got a really bad flu for a few days. you can still survive at home. You just take paracetamol and so on, and you'll be fine. Just let me say at this point, I'm not a medical professional. Stacey, I'm not sure if you are. We're not giving medical advice. We're not giving medical opinions here. We're just telling people what we've heard. The big issue, of course, is the 5 to 10% of people who are going to need hospitalization. And that really is what lockdown is for. This concept of flattening the curve, we're not going to get rid of this disease. We're not going to get it out of the system until we get a vaccine, and that's at least 12 months away, more likely 18 months from now. So we're going to be well into 2021 before we get any sort of handle on this disease. The main thing we're trying to do at the moment is to make sure that the number of people who need hospital care doesn't overwhelm the hospital availability. That's all we're trying to do at the moment. We can't cure this. We can't get rid of this disease. Many of us are going to get it. And about 10 to 15% of people who are going to need some hospital care, we just want to make sure we don't overwhelm the hospitals in one go. And that's when you look at New York, when you look at Italy, when you look at Spain at the moment, you begin to see what could happen if the healthcare system gets overwhelmed. So the first thing we need is lots of testing. The second thing we need is everybody who is found to have had the disease or has the disease, is infectious, in other words, we need to try and contact all the people they've been in contact with. Now, obviously, if you've been locked down, if you've been shut in one place for a while, that's easy, right? It's only your own family or the people you lock down. That's why lockdown's important. If you've been moving around, if you've been going to the office, if you've been going out to the shops, we literally have to try and track everybody down. Now, South Korea did this very effectively. It's a different culture to America. In South Korea, they basically asked the cell phone companies to give them all the data, and they literally used their cell phone tracking to track people back. I can't imagine that's going to happen in America. That feels like a little bit more of an invasion of privacy than Americans would be comfortable with. But as far as possible, we've got to track back all the people you've connected with and just test them. So it just adds to the extensive testing. If you have the disease and you're in the infectious stage, which is the first 14 days when you don't even know you've got it, we have to quarantine you. So actually lock you up even tighter. That again might not be the word people want to hear, but we need to make sure you self-isolate very, very strictly. And then the other two things we need, and of course you've heard so much about this over the last few weeks in America, we need that PPE, that personal protective equipment for the first responders and doctors and nurses and so on. And we need to make sure we've got enough hospital facilities, which includes ventilators and medicines and so on. So the countries that have been successful in dealing with lockdown have done those 5 things. And those countries include China, South Korea, Singapore, Taiwan. New Zealand's looking pretty good at the moment. My home country, South Africa, is not looking too bad at the moment. Austria, interestingly, in Europe has just announced the end of their lockdown. And so there is a pattern to how lockdown works. But here is what that pattern looks like. In week 1 of lockdown, we don't really have a lockdown. All around the world, the first week has been pandemonium. Nobody's really locked down. Everybody's gone for a run on the beachfront and had their Corona parties. If you're a millennial, you know, it's been chaos. That's been true everywhere. So don't be too hard on yourself, America. Everybody did it. Then the second week of lockdown, whatever your curve was, that curve pretty much stays the same. So in New York, unfortunately, the curve was pretty much exponential already, and it just continued. In other parts of America, there's been a flatter curve. So Florida, for example, and so on, there's a little bit more of a flatter curve, and that stays in place for the second week simply because of this lag time that we've got. And that's a danger, right? Because you've got people, I saw examples in Louisiana, for example, this past week, where people are saying, why should we lock down? It's not making any difference. And so there's a danger, you know, that the first and second week give you this false sense of nothing's happening. The big issue is the third week. And that's when whatever's going to happen, it happens. And if it's bad, it gets very bad. And that's what we saw in Seattle a week or two ago. They were the first to kind of go. Now we see it in New York. It's coming to Washington, it looks like. So third week is really bad. And that's where you realize you have to extend the stay-at-home order or the shelter-in-place order. 3 weeks is just not enough. As again, we've date stamped this to the 9th of April. I'm here in South Africa, as I've said. Literally an hour ago, our president extended our lockdown from an initial 21 days. Now he's added an extra 14 days. And that wasn't unexpected. It looks as if 5 weeks is about the normal. So week 3 and 4, you begin to see this increase in cases, infections, deaths begin. And then in week 5, you begin to see it flattening out. And week 6 and 7, it begins to tail off. And then we know we've dealt with it, if you've dealt with it. Right. So Italy didn't deal with it. And so Italy is kind of into week 7 and 8, and they're still struggling because they overwhelmed their hospitals. So if I can give you the first of a few practical tips, and I'll get to a few practical things in a moment. The first is, please just stay at home. You know, lock down, socially distance yourself, all those things that you've heard people say. It really does work, and it is best practice. Even if it's not mandatory in your state, please just do it. It makes sense. We don't want to overwhelm the hospitals. That's a disaster. When that happens, you really are into very, very difficult territory. But here's now so that's how lockdown plays out. Then the real problem actually starts. So sorry, I hope everybody's sitting down to watch this, because there is some good news that I'm getting to it, but it just like gets worse and worse, sadly. Because when lockdown ends, so if the state then says, right, your shelter-in-place order is now over, that doesn't mean it's over. That means that you've been given permission to go out again. But we will still have to be socially distancing from each other. We will never be we won't be shaking hands for a while. I see Dr. Fauci actually said that yesterday. He said, maybe we will never shake hands again, in terms of us always being aware that this virus is sitting in the system somewhere. So we will have to socially distance ourselves. Even if your company gets permission and says to people, right, come back to the office, you are going to have to be sitting sort of 6 feet from each other. Now think of your office space. Is your office space, you know, if you've got a call center, you've probably got a whole lot of people crammed into a big open plan office. That's just not going to be acceptable anytime in the next 18 months, right? Until we have a vaccine. This is a big, so Stacey, I just see your face as I say that. I can imagine the faces of people watching this. That's a big thought, right? To kind of say, you know, you can't bring all your employees back to the office at the same time. You're going to have to go to a shift mindset. Some people are going to have to work from home and stay working from home for a while. There's definitely not going to be international travel for a long time. Because China, for example, lifted their lockdown 3 weeks ago. And if you visit China today, they will allow you in, but you have to go into 14 days quarantine in a state quarantine facility. Now, if you want to freak yourself out, just do a Google search for Chinese state quarantine facility and decide whether that's something you want to do or not. The answer, by the way, is no, just in case you've done it. And, you know, I can't imagine too many places in the world just allowing free travel in the next few months. So again, we might get to a point where we say, great, lockdown is ended. Let's think New York, for example, or Chicago. And in the city, you can maybe go to a restaurant, but the restaurant's only allowed to have half the tables it used to have, because you got to have 6 feet between everybody. So that they're running at half capacity. If you get onto an aeroplane, you have to have 6 feet between you and the next person on the aeroplane.
Wow.
Do you think any of the low-cost carriers, you know, Southwest or whatever, do you think they're going to think that's viable? Maybe they'd prefer to not fly their planes with only having one person in each row. I mean, it probably doesn't make financial sense to them. The same with buses and trains and whatever other things you use. So again, in America, you obviously, you mainly use your own cars, so you can drive everywhere. But malls might have, and shops might have a limit to the number of people they allow in the shop at any one stage. And so that's not going to go away for quite a few months now, even if we feel we've overcome the initial surge of COVID cases. So yeah, as I say, I hope everybody's sitting down. You might need a stiff drink at this point. If you're watching the replay, hit pause and just breathe for a few minutes and come back. There is good news, I promise. The point I suppose, Stacey, that I want to leave with people is we can't just think that this is just a little blip in history. It's a few weeks. We've all been told to just shelter in place. So, you know, go and stock up on your credit card and go home and learn to work from home, do the odd Zoom call, do what you can from home, maybe take a break. It was Easter after all. So, you know, take a long weekend off and then we go back to work. You know, then at the end of April, beginning of May, we all get back to normal and we pick things up. It's not going to happen. And it's not going to happen in May or June or July. And it might not happen even towards the end of the year. And then just in case you didn't have enough bad news yet, I promise you good news is coming. There's one more piece of bad news. It's called the second wave. Now, this we get from history. You've probably heard people talking about the Spanish flu from a century ago. Back in 1918, the Spanish flu hit the world, and it actually killed more people. More people died of the Spanish flu than had been killed in World War I.
Right.
So 4 years of World War and then one winter of Spanish flu, and you got more people dead. We just got over that in kind of the February, the March of 1919, and everybody was saying, wow, okay, that was unbelievable. But then in the winter of 1919, October, November, it came back again and killed the same number of people again in 1919. So it had the second wave. And again, this is what futurists do. We actually spend a lot of time reading history textbooks because you see patterns in history. And so there's a danger that we get through this little hump. Summer comes, the COVID viruses don't like warm weather. So it appears that we've kind of got over it, but it's lurking in the system. And come September, October, November, it comes roaring back in exactly the same way we've just seen it in the last few weeks, which would be a disaster, obviously. So we really are going to be on high alert. We're going to continue to be social distancing, continue to have travel restrictions. Many countries around the world are going to continue with quite strict controls over how many people can be in public spaces. I can't imagine going to a concert, for example. I can't imagine going to a movie theater. I can't imagine going into a packed restaurant anytime in 2020. Now, again, I apologize to you if you're in the retail business, the hospitality industry, the travel industry, if you're if you've got a call center in your office space. I know you don't want to hear this, but honestly, this is, I think, the reality of where we find ourselves in the next 12 to 18 months. So I keep promising you good news. Let me try and give you some. I think there are 3 bits of good news. I think that because we've seen what happened in Italy, because we see what's happening in New York, and they are really fighting hard right now at the beginning of April in New York, I think a lot of other states and cities have got a big wake-up call. And I think that it is possible to flatten the curve. That's the language that we use. To, again, just to remind us what we mean by that, it doesn't mean we have no infections. It doesn't mean that you and I, Stacey, are safe from this. I'm pretty sure you and I will both get COVID sometime in the next 2 to 3 years. We just don't want it now, right? And we don't all want it at the same time. And so we hopefully can flatten that curve and make sure that the number of new infections doesn't exceed the hospital capacity in our state. So the good news is I think a lot of states have realized how serious this is, and I think a lot of individuals in those states have realized how serious it is, are staying at home, are self-isolating. I think the news has got out. We're working hard. We're washing our hands. We're doing all the things we've been told to do. And that's the second piece of good news, is that this disease, although it is a real, I have to be careful, different words are swear words in different parts of the world. So I was just about to say something which I think is a bit sweary in America. This is a nasty disease. This really is, this COVID thing. Not for the 50% of people who will just have mild symptoms and get over it, but for the vulnerable people being people who have been sick recently, people who are elderly, people like me. I'm not one of those people who just says, oh, well, there's a few vulnerable people, we're fine. I have asthma. I am a vulnerable person. If I get this disease, I'm going to be in trouble. So, you know, but it's a small percentage of us who are vulnerable, but we are very vulnerable if we get it. But the good news in that is that this disease is also actually quite easy to beat. I say that advisedly. It is the largest coronavirus we've ever seen. Now, you can't see it with your eyes, but at an atomic level, it is the largest coronavirus we've ever seen, which means that it isn't airborne. It can't just live in the air. It comes out, if you've got it, it sits in your lungs, you breathe it out, and because it's too big, it kind of flies out and then falls onto the nearest surface, literally within a meter of you. Okay. And then it sits on the surface. Now, the nastiness of this disease is it can survive on surfaces for days, not just minutes and hours, but days. So you could go for a run. You might be infected. You're still healthy. You don't know you're infected. You go for a run in your community. You think, I'm not near anybody, but you're breathing a little bit hard on your run. You run past a neighbor's post box, for example. You just breathe on it. Out goes the COVID virus. 4 hours later, your neighbor goes out to check the post, doesn't see anybody in sight, thinks, oh, there's no issue here, opens the post box, takes the post out, and has now got active COVID-19 on their fingers. Again, wow. I'm not a medical expert. I'm not a scientist in this space. I'm just telling you what the scientists are telling us. But you don't get it through your fingers. Unless you've got a cut on your hand, it's not going into your body. It only goes in if it touches someplace moist, your ears, your eyes, your nose, your mouth. So if you go inside and you wash your hands, we all have heard this, for 20 seconds with soapy water, it kills the virus. I mean, literally, it doesn't require any major medicines, any major chemicals, literally soap, not even antibacterial soap, literally just any soap you've got, warm water, 20 seconds, boom, boom, you're sorted. So if you follow the advice of the medical professionals, of the CDC and everything else, honestly, it is actually good advice. And in this particular case, it does actually work. So I know it's a little piece of good news. It's not the best news in the world, but it is at least some good news. The third piece of good news is that the scientists who work on this stuff, they're called epidemiologists. I mean, who knew? I didn't. It certainly didn't come up in any career tests I ever did, you know, become an epidemiologist. But there are quite a lot of them in the world. I discovered that a childhood friend of mine is a world famous epidemiologist in the last few weeks. She's been working her whole life, 25 years of career, preparing for this, because she studied global pandemics and how they spread and what the models are. And it's her time to shine now, because she really knows what she's talking about, and everything that she has predicted in terms of how these things spread and what we have to do, that's what's happening. And so it's those experts who are giving us advice about what to do. They told us to lock down. They told us to wash our hands, and they're right. And they are now working together on a vaccine. And apparently I was listening to one of the New York Times's The Daily podcast. And about 3 or 4 days ago, they interviewed one of these people working on the vaccine. And they say that there is unprecedented international cooperation at the moment. Apparently they are just enjoying it so much that colleagues from all around the world are just sharing everything. They're trying things, and they reckon they will make a vaccine faster than they've ever made a vaccine in the history of the world before, which is remarkable. That still means it's 12 months. So that's the fastest a vaccine will ever have been made ever in the history of the world.
Wow.
Most vaccines take 7 years to develop. And they reckon they can do it in a year. Bill Gates has said that he is looking at the 7 best projects at the moment. So he's looking at all of this international cooperation. He's identified the 7 that he thinks are most likely, and he has literally started building the factories that can make those vaccines already. And he started about a week or 2 ago building these factories. He says he knows that 3 or 4 of these vaccines are going to be dead ends. They're not going to work, and he can just basically throw the factory away. But what he wants to do is have the factory ready if the vaccine actually works, so that the day after we agree this is the right vaccine, he can start producing it at global scale. I mean, I just think that's remarkable. You know, a hand clap for a billionaire who says, hey, I've got some money spare, you know, let's use it wisely. So that's the information. I've probably taken a little bit longer than I thought to sort of download that to you, but I hope that was useful and interesting. Let me make one final point, and then Stacey, if you've got any questions, let's take those. I hope that what you've heard from me in the half hour I've been talking helps you to realize that my next statement must be true. And that statement is this: there is no normal to go back to. I think that a lot of people are hoping or speaking or saying, I wish we would just quickly get over this so that we can go back to the job that is waiting for me, go back to the office that I'm missing at the moment because I'm stuck with my kids, go back to life as we know it. I wish we could just go back. And I honestly believe that we need to be thinking in our minds along the same lines that you would think if we were in a world war. Let's say Finland had bombed Paris with a nuclear bomb, and India had invaded Pakistan on the back of that, and we were now at war, and America chose sides and sent the military off to the war, and then somebody bombs Los Angeles. And we wouldn't all be sitting here saying, oh, I wonder when the schools are going to open again. And I wonder when I can go and get my hair cut. And I wonder when that movie I was hoping I could go and see is going to be released now because it's been delayed. We would all be saying, oh my good grief, the world's at war. What a mess. It's going to be a few years before we sort ourselves out. It's not as bad as that, but I honestly think that's the mindset we need to take. We need to realize that maybe the workplace you worked at might be bombed while you're away, and there isn't a workplace to go back to. That's going to be true for many people. Your company isn't going to exist. Sadly, I probably shouldn't say that so flippantly, because that's a really horrible thing for us to think about. Even when we go back to work, it's not going to be the way that we thought it was, as I've explained. And I honestly think that, again, let me be careful as a non-American, as a person who visits your country often, the conversation around healthcare. I know this is a very politicized statement to make, so I'm not going to declare my sides on this, but I'm sure you can imagine as somebody outside of America, which side I'd come down on. I don't understand why Americans have to be worried about whether they can get healthcare or not. I mean, I live in basically a third world country and I'm not worried. I know that my government will, if I fall sick, I will be taken to a hospital and I'll be cared for. And it's not going to cost me much because that's what I get as a citizen of a country. As I say, now I am already politicized. You now know which side I'm on. But the point is, I don't see how you come out the other side of this and still be the same America. You've got an election that's going to happen in the middle of social distancing. And this issue isn't going to disappear by October. It's going to be the defining feature of the presidential campaign. And it is going to shape America for generations to come. We'll learn about it in our history textbooks, and our children and grandchildren will ask us, what was the world like before COVID? And that's what I think we have to start thinking about. So for everybody who watches this, Stacey, for all of the people that you share it with, my advice to you is, yes, I know some of you are in crisis, and I know you need to get through your crisis, and that's great. And do what you need to do and stay safe and stay sane. But as soon as possible, you need to begin getting your team together and start talking about, what does the next 12 to 18 months look like? If I'm right, your world is going to be very different immediately. Even if you're allowed to go back to the office, it's going to have to look different very, very quickly. So what does that look like? But then what does 2021, 2022, 2025 look like? What will the United States look like? What will your state look like? Then what will the United States look like? Then what will the world look like after that? And I'm not sure anybody's got the answers yet to those questions, but those are the right questions. And if you get the right answers, you might give yourself a real competitive advantage in your industry and get ahead of your competitors and put something together. You have the most amazing blank slate to work with right now. This is a once in a lifetime opportunity to do all the innovation, all the disruptive change, all the things you ever dreamed of and things you hadn't even thought of yet, and to actually do it. And maybe it's too early for some of you to have somebody talking this type of language right now, but this is where I want to leave you. This was the good news I was aiming to get to half an hour ago, to say it is an opportunity for us to build a world that doesn't have all the problems and frustrations and issues you used to have. Simple example, Stacey, to end with is rush hour traffic was always horrible, right? Nobody ever said, I really am looking forward to getting into the traffic tomorrow morning. We are in the middle of the greatest work experiment in the history of humanity, sending everybody home and forcing all of us to work from home, to get used to webinars and online chats and all the rest. What happens if it works? What happens if a whole lot of us love it and never want to go back to the office? Maybe we solve high rentals in city centers. Maybe we solve office crowding. Maybe we solve rush hour traffic. Maybe we solve climate change at the same time. Who knows what we could do? So it's a bit of an upbeat note to end, I know, in a very downbeat moment in human history. But Stacey, that's my story. I hope it's been useful and interesting to people and gives them a sense of what might happen next. If people would like more information, or to be honest, if people would even like me to chat to their teams about this, obviously they can just look me up on graemecodrington.com, and I'd happily be able to share this with them directly as well.
Perfect. I really appreciate it. I did have one question. I know it's a big topic. So a lot of our folks within Women in Manufacturing obviously are in the manufacturing space in different roles. So I was wondering, it seems to be kind of an interesting mix of some countries really taking a national sort of insular focus. But then you said there was a lot of really great collaboration in terms of research and development to build a vaccine. Do you have any, forecast of how you think maybe manufacturing supply chains are going to change over time, and what the level of cooperation might look like over the long run?
Yeah, it's a very important question. In fact, I was just asked that question by a mining company here in South Africa just this morning, who's wanting to know about commodities and trade and that internationally. Again, it's probably a little bit too early to tell, because I think we're seeing both things happen at the same time. We're seeing global cooperation, honestly, like we've never seen it before. I don't think there's been a time, certainly not in my 50 years on this planet, where I've kind of felt part of all of humanity. The fact that I can look at that John Hopkins heat map In fact, I've actually got it here. I can put it up in case people don't know what I'm talking about. You know, and we can have a look at all the countries around the world that have this and realize it's every single country on the planet.
Oh, wow.
You know, nobody's exempt from this. We're all learning from each other. We're all watching each other. We're all trying to get best practice. Governments are communicating and connecting and so on. So at one level, we kind of have got the benefit of globalization, that we're all completely connected 24/7, instantly updated around. I mean, you know, we're on opposite sides of the world here, and we're having this conversation here today. On the other hand, of course, maybe I can give a little frivolous example again. So in Australia was the first country to have the great toilet roll rush of 2020. And the reason was actually a genuine reason. As far as I understand, Australia doesn't manufacture any toilet roll in country.
Oh.
All of their toilet roll is imported from China. And as soon as people in Australia put two and two together, they said, well, the supply chain, the factory's going to shut down, the supply chain's going to be disrupted. We're going to run out of toilet paper as a nation. Now, in South Africa, a lot of South Africans have emigrated to Australia. So a lot of us have got family and friends in Australia. We saw the panic in Australia about hoarding toilet rolls. In South Africa, we went out and hoarded toilet rolls, but we've got 5 massive toilet roll manufacturers. We supply most of Africa with toilet rolls. We are never going to run out of toilet rolls. And now some of my friends personally will never run out of toilet rolls. They've got 400 toilet rolls in their garage, you know, and they don't know what to do with them now because they hoarded them unnecessarily. And, you know, most of us have no idea which products we purchase are made in our state, made in our country, imported from where. You know, we might look at the label every now and again and say, oh, made in Vietnam or whatever, but most of us have no idea. And I do think the opposite side of the globalization will also happen. We'll probably have the conversation as states and as countries to say, well, are there certain things that we didn't realize were essential? Now we do, because we've had a few weeks of not having them. We suddenly realized this is actually needs to be part of our strategic thinking. And so I don't think it's going to be a one-size-fits-all answer to your question, but I think each person watching this, if they're in manufacturing, might need to ask, is the thing I am manufacturing, are the goods that I am manufacturing, would these goods be considered in the strategic interest of our nation? Then you might be exposed to more nationalistic tendencies and people thinking, well, I need to keep this in my country. If you're supplying internationally, you might discover other countries say, well, we don't want to rely on you anymore because, and again, I'm sorry to bring bad news in again, this is not the last coronavirus that's ever going to hit the world. This is just the worst one we've ever had, but the next one might be worse. And there'll be one after that and one after that. Coronaviruses continually mutate and they come at us. So we now know that we might be doing this every 10 years or so. You know, we had SARS 15 years ago. Now we've got this 10, 15 years from now, we might have another one. And so depending on the product that you're producing in your factory, you might need to think, no, we're okay. You know, the global system still works. Or you might need to think, actually, there might be a few of our customers who don't want to have this product as an import in their country. And so you're going to have to, depending on the product, you're going to have to work that answer out for yourself. But it's definitely, again, to reiterate my main point, there's no normal. We're not going back to how things were. A lot of things are going to change in the system. And I think it's probably too early to predict with any certainty what that looks like.
I think those are some great points. I mean, just thinking it through, there's going to be impacts on supply chain, on marketing, on customer analysis, the whole spectrum. You know, I'm imagining the case studies that will come out of this that will be deployed at, you know, within companies, at schools, to help people think through what happens when the unexpected happens. What are the ramifications of it? You know, and the other thing I wanted to pick your brain about real briefly, there's definitely going to be individuals that are impacted by this, obviously. And I would imagine they're going to be looking at how companies responded to COVID-19 when they're looking for employment or when they're talking with their kids or their friends and neighbors. Is that something that people have asked you about as well?
Yeah, in fact, our team literally ran a webinar on this yesterday. One of my colleagues is a diversity and organizational culture expert.
Mhm.
And in fact, you know what, let me just take this opportunity to just put up a set of contact details
Perfect.
if people are interested.
Mhm.
If you go to, you'll see I've put my personal website, but my company is tomorrowtodayglobal.com. So if you go to the tomorrowtodayglobal.com website and click on the webinars link. So this is something we've adapted quite quickly. We've moved to webinars, and on the webinar link for the 8th of April, you'll see that we had a conversation. I had a conversation with my Canadian-based colleague, and he and I were talking, and he made a fascinating point. He said, there are people at the moment, they're under stress. We're all in a state of anxiety. Social media is chaos at the moment. I don't know what it's like in your network, Stacey, but it's just madness on my platforms at the moment. Everything from conspiracy theories to quack cures and everything else. And he said that the danger is that you say something right now in the heat of the moment, in the middle of your stress and anxiety, that actually, if you think about it, if you said that in your office a few weeks ago, you would have been called up on a disciplinary for racism or sexism or something like that. And he was pointing out, you know, if you make a joke about this being the Chinese virus, and a lot of Asian American, a lot of Chinese people around the world are saying they are getting these things. People saying, oh, you Chinese, do you carry the virus? Meant to be a joke, but that kind of thing's not a joke if you're Chinese, right? And if somebody later takes something you said on social media or in a email to your colleagues that you probably wouldn't do in normal times, but because you're stressed, you're saying it now, there might be disciplinary things going on a little bit later. So people really need to think through what they are doing personally. And then that comes, Stacey, to your question. What are companies doing at the moment? Some companies have been horrific. The first thing they've done is I heard something literally, there were like 3 cases of COVID in the United States. And a friend of mine who works for a reasonably large financial services company, basically the boss came in and said, everybody has been retrenched. And literally, you've all gone, every single one of you. And then he left the office and they started packing up their stuff. He said, please, you have to leave the office within 2 hours, you know, clear your desks. Half an hour later, he came back in and he said, we are offering to rehire you at 60% of your the package that you were on an hour ago. And I just, you know, and pretty much everybody in the room said, okay, we'll do it. I mean, what choice did they have? You either have the choice of being unemployed with no health insurance or accepting this like ridiculous offer. And, you know, his basic response was, the very first opportunity I get to leave this employer, and I think that there are a lot of employers who are going to regret some of the crisis decisions they've made in the last few weeks.
Right.
And I think customers are watching too.
Yes.
I got an email 3 days ago from my fiber provider. So, you know, I'm not sure exactly what the right language is for you in the States, but, you know, it's where I get my internet from and my data connection, my phone and so on. And the provider just sent an email, said, obviously, we understand everybody's working from home. You are using a lot more data than you expected to. And we understand this. And so we have removed the fair use policy. You can use as much data as you like. We're not going to check. Secondly, we have upgraded you to the package above the package you've got at no cost until the 1st of June. And that will give you faster speed, more data. and there's no cost to you. We really hope this makes a difference to you as you lock down at home. You know, best regards, the CEO of the company. And I just thought, good grief,
Wow.
you know, am I going to be changing service providers at the end of lockdown? Absolutely not. You know, it probably costs them nothing. It maybe costs them a bit, I don't know. But honestly, there are companies that are making a name for themselves, and companies that are ruining their reputations in such a way that I think some of their customers will never forgive them afterwards. And they're going to come back again. The whole point I'm trying to make to you, there's no normal to go back to, because customer loyalty will change, employee loyalty will change. You might not be able to get your employees back if you put them all on furlough or unpaid leave. Why do you think they're going to come back to you afterwards? So this is a massive, massive shakeup, absolutely. And I really hope if anybody's listening and you have influence over your company's policies towards customers, towards staff, please do the right thing and think long term, because that honestly could ruin you more than just the fact that you haven't had a few sales for a few weeks.
Right.
Your reputation and your engagement with customers and staff could be forever altered after this.
I couldn't agree more. I really want to thank you, Graeme, for your time today and your perspective, not only on the current situation, but your insights for the future. And as Graeme mentioned, he has access to all of his social, his website, etc. So please feel free to reach out to him. And if you have questions about the upcoming webinars that he's doing for women in manufacturing, I'm happy to answer any questions that you have. Thank you so much for your time. Stay safe and stay well.
And back to you. Thank you, Stacey. Looking forward to working with you later in the year. I know it was always planned to be an online session. I'm coming for our IMS sessions later in September. I really hope I can be there face to face. I'm guessing I won't be, but at least we can do it this way. So thank you so much.
Yeah, thank you. Take care, Graeme.
Thank you.